Welcome everyone, and thank you for joining us today for Osteoporosis Canada's webinar, Yoga and Osteoporosis, Suggestions for Safe and Appropriate Practice. Before we begin today's webinar, Osteoporosis Canada acknowledges the land that our offices, located in Toronto, are on the traditional territory of many nations, including the Mississauga of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis. We also acknowledge that Toronto is covered by Treaty 13 with the Mississauga of the Credit. My name is Tanya Long, Senior Manager, National Education at Osteoporosis Canada, and I will be your moderator today. This webinar is presented in partnership with COPN, that's C-O-P-N, the Canadian Osteoporosis Patient Network. COPN is the patient arm of Osteoporosis Canada, a national network of people living with osteoporosis. It represents their interests within Osteoporosis Canada's programs and activities, including research, advocacy, and education. To sign up free of charge, go to osteoporosis.ca/COPN. The webinar will provide general information about safe yoga practice and exercise. It is not intended as individual health advice. If you have questions about exercise, please consult a physician. If you have questions during the webinar, you can enter them by clicking the Q&A button at the bottom of your screen. We will do our best to answer as many questions as we can during the webinar with the time available. McArthur, PhD, is a registered physiotherapist and assistant professor at Dalhousie University in the School of Physiotherapy. She completed her PhD in kinesiology at the University of Waterloo, with special interest in aging, health, and well-being. Her research focuses on falls, fractures, and functional mobility in home and long-term care. Yoga is a popular form of exercise that can help improve strength, balance, and flexibility. But for those who have been diagnosed with osteoporosis, are at high risk of fracture, or have had a spine fracture, some poses need to be modified or avoided altogether. Dr. McArthur will discuss these, demonstrate some poses, and outline the principles of safe yoga exercise. Dr. McArthur, over to you.
Great, thank you so much. Okay, so thanks so much for having me here today to talk about yoga and osteoporosis. I'd first just like to acknowledge my coworker, my colleague, who will be doing the instructions. So you'll notice some videos kind of embedded throughout my presentation, and these have been provided by Dr. Adria Quigley, who obtained her PhD from Dalhousie. And in her PhD, she studied the feasibility and impact of yoga on cognitive and physical function among people living with HIV. So she has lots of experience with yoga and how to modify certain poses. So you'll see her videos kind of throughout the presentation today. So the topics we're going to talk about today, or the objectives for this webinar, are first we're going to discuss the effect of yoga for people with osteoporosis. Then we're going to talk about overall principles of a safe yoga culture. Then I'm going to talk and provide an overview of what movements in yoga practice should be modified, and provide you with examples of how they should be modified, and give you some information about why we need to modify those particular poses for people with osteoporosis. And I hope to answer frequently asked questions as well. We'll have some time to answer questions at the end, but I've also embedded some questions that I'm frequently asked when I talk about yoga and osteoporosis, either with the general public or with patients who come to see me as a physiotherapist. So the first thing I want to do up front is talk about the effects of yoga for people with osteoporosis. Now, this is an area that we don't have a lot of research about. There is some research, but it's not a lot. There's not a lot of studies that have been done. But what we do know with the ones that have been done is that there's no good quality evidence that yoga has any effect on bone mineral density. So we don't know for sure that it increases or decreases our bone mineral density. We just don't have enough good quality evidence about that. However, we do know that yoga for people with osteoporosis can improve quality of life and balance. And as you can imagine, quality of life is really important because it's all about how you're feeling about life and your mood and all of those really important things. So that's really important that it can improve quality of life. And balance is important because, as you probably know, a lot of fractures happen because of falls. And a lot of falls happen because of impaired balance, or maybe your balance isn't that great. So a lot of people will fall because they lose their balance when they're trying to shift their weight, or when they're trying to walk, or when they're trying to turn around. And so we know that yoga can help improve balance, so it can help improve or prevent falls. And we know that many fractures happen because of falls. So that's really important that it can improve balance. So it can hopefully prevent fractures that way. But fractures have been reported as a result of yoga. So when we look through the research, we do see that there are reports of fractures happening during yoga. And we'll talk about what positions those often happened in. But just be aware that participating in yoga can result in fractures. Just like any activity, there's pros and cons, and there's risks that you are taking by engaging in it. So it's really important that care is taken when doing yoga if you have low bone mass. So you notice here I say low bone mass and not just osteoporosis, but anybody who has low bone mass, so this includes what you might hear as osteopenia, as well as osteoporosis. It's really important that care is taken, and how you practice is really thoughtful to try to prevent fractures. So overall, we don't really know if it affects bone mineral density. We do know that it can improve quality of life and improve balance, which hopefully will help prevent falls. But we have to be careful because fractures have been reported and there's things that we need to modify. So first things first, if you're new to yoga, you have a history of spine fractures, or you're feeling uncertain about what to do, you're just feeling uneasy, it's really important to reach out to somebody who is trained and knows about osteoporosis. So if you've never done yoga before and it's something you'd like to start, maybe you've had a spine fracture recently, or you just feel really uncomfortable because you're not quite sure what to do, I would highly recommend consulting somebody who has special training in osteoporosis and how to modify things, because they can give you that individualized one-on-one feedback. You can talk through different postures or positions that you're in, and things that are very specific to you. So I would recommend seeing a physiotherapist because they have training, special training about how the body works, and particularly one that has training about osteoporosis. So you can look on the BoneFit locator. The website is listed here for you, bonefit.ca/locator. And what that will do is it pulls up a map and it tells you all of the people around you who are BoneFit trained. And BoneFit training is basically a special course where people learn about osteoporosis and how to work with people with osteoporosis. So they have some more advanced knowledge than just your average physiotherapist does about bone health. On that locator, you can actually find other professionals and other exercise instructors who are BoneFit trained. So you could find, for example, personal trainers, kinesiologists, Even yoga instructors are listed there as well. So if you're looking for a yoga instructor who's also bone fit trained, you could find them on this locator. So it's just a really good idea if you're looking for that individualized information to talk with somebody who has training in this area. So that's my first recommendation. The second recommendation when we think about yoga is you want to seek out a yoga class that's designed for people with osteoporosis, as well as people with other health conditions, like, for example, osteoarthritis. We know a lot of times these two things kind of exist together. You also want to ensure that your instructor has proper training for working with this population. So maybe they are bone fit trained, or maybe they've done some additional training as a yoga instructor. So you want to make sure that you're seeking out a class that is appropriate for you. There are some registries that you can look at to make sure that your yoga instructor is trained. One example is the Yoga Alliance that is listed at the bottom of this slide. The third suggestion is really about you and advocating for yourself. So it's really important that you make sure your yoga instructor knows you have osteoporosis. So if they don't do any sort of intake questionnaire, hopefully they do, but let's say they don't, or let's say they do an intake questionnaire, but there's no check mark for osteoporosis, or you don't have anywhere to tell them about it, or maybe it's a new diagnosis that you didn't know before. It's really important that you make sure to tell your yoga instructor that you have osteoporosis. This allows you to advocate for yourself and lets you kind of take charge of the situation. So when you tell them that, hopefully they will give you some suggestions on things you might need to modify. But even if they don't, then they at least know why you might be doing things differently compared to other people in the class. So if you start doing some of the modifications I talked about today, then at least they kind of know where you're coming from, and they're not saying, hey, why are you doing it that way? Or, make sure that you do it this way. So really advocate for yourself and let them know that you have osteoporosis, and that's why you might be doing things a little bit differently. And the fourth consideration for you is to really focus on controlled movements and less on the intensity. So a lot of times we can feel like yoga is a competition between you and the person on the mat beside you, especially if we're in person. Virtual might be a little bit different, but maybe you can see the people on the screen and you feel like you have to do it exactly the way they're doing it or exactly the way the instructor is telling you to do it. But it's really important that you work at your own level and pace. A lot of times classes are designed for kind of general or the average person, and you have special considerations as having low bone mass. So make sure that you're taking care of yourself, working at your own level and pace. Injuries often happen when you try to force yourself into extreme positions or do things to try to match somebody else. So really focus on being controlled and less on how intense you're going into a posture or how well you're doing it compared to the person beside you. Another really important thing to think about is keeping your balance steady. So when you're going through your postures, you're going through your yoga class, we want to try to keep our balance steady. And why this is important is, as I mentioned, a lot of fractures happen when we fall. And sometimes it's as simple as just losing your balance and landing on your wrist. I'm sure some of you have experienced this. Maybe you slip on the ice and you end up breaking your wrist. So the same thing could happen in a yoga class. So it's really important to really focus on keeping your balance steady. Some ways you can do this are to focus on one point with your eyes and maintain firm contact with a support object. So this might be something like a wall. It might be something like the ground, perhaps if you're doing something on the floor, or it could be a steady chair. So you'll notice I put the word steady chair because sometimes we hold on to chairs and they might not be that steady. And if we begin to fall, the chair falls with us. So do make sure it's a firm, steady chair. If it's going to move around at all, it's better to use something like a wall or a counter that's not going to move. And really you could maintain contact with the support object with either your feet or your hands, depending on what type of position it is that you're doing. So, you might be holding onto the wall, or perhaps you're in a position on the floor and you really want to try to maintain your balance on your hands. For example, if you're on your hands and knees. The next thing you want to think about is keeping good alignment. And we'll talk about this. This is kind of one of the most important things that we're going to talk about. You want to try to keep your spine as tall, lengthened, and straight as possible throughout each of the posture and each of the transitions. So transitions are really important too. It's not necessarily just the posture that you're doing, just the position that you're in. It's how you get in and out of it that can sometimes be more risky. So we really want to think about a tall, lengthened, upright, straight spine as much as possible. And I'll give you lots of examples of how to do this. So here's a general overall suggestion and recommendation of what to modify. So you want to modify any movements that make you bend forward at your spine, backwards, or twist as far as you can. So an example of bending forwards as far as you can is ragdoll, or where you're doing like a standing forward bend or forward fold, and you're bent forward at your waist kind of as far as you can go. But the same applies for backwards. So some extension or moving backwards is good, but if it's a position that's putting you into extreme extension or really bending back as far as you can, then that can also be too much for the spine. And then twists are also really important. So we'll talk about some examples of those in a few minutes. You want to modify any position or any movement that you're doing that's in sitting. So for example, a seated twist. So anything that you're doing when you're sitting, whether it's sitting on the floor or sitting in a chair, you need to be really conscious of how you're doing it and put in some modifications. Not saying it can't be done. You certainly can do things in sitting. You just have to be very conscious of how you're sitting. And why this is important is because when we're sitting, we have a lot of compression on our spine already, just the nature of how our body works. When you're standing, you don't quite have as much compression. When you're lying on your back, you actually have very little compression. But when you're sitting, you actually have a lot of compression on your back, on your spine. And so if you're already compressed or doing this sitting motion, and then you compress even further, like bending or twisting, then you could be putting yourself at risk for fractures. And this is actually where we've seen fractures happen in yoga, is with twisting motions. And the last one that you want to modify is to put your hip, forcing your hip into full rotation, usually external rotations, that's moving it outwards or out to the side and rotating it with your body weight on it or a lot of weight on it. And this is because that can put a lot of pressure on the bones that make up your hip. So the top of your thigh bone and your pelvis bone, that can put a lot of pressure on there. And if you have low bone mass, that could result in fractures there. So an example of this is pigeon pose, which you can see in the picture on the right-hand side here. So I'll give you some examples of how to modify that. You also want to modify any spine movements or back movements that are repetitive. So that's doing a movement over and over. So for example, rolling like a ball, where you are rolling, you hug your knees into your chest, you're lying on your back, and you're rolling up and down your spine. So that's a repetitive action. Or maybe you're doing forward folds repetitively over and over. You want to try to modify those. Anything that's rapid, that moves really fast or quickly. So an example of this is jumping your feet to your hands from downward facing dog. So downward facing dog is a really great position, but when you then transition by jumping your feet to your hands, you're moving really quickly into a forward or flexed position, and that can cause a lot of stress on the spine. You also want to modify any spine movements that are weighted. So for example, maybe in your yoga class, you do some work with resistance bands or with Russian twists or dumbbells, because there's a strength component that's been added. But you want to be careful with this. So holding a weight or something heavy while you do the movement is not, it needs to be modified. So an example would be a Russian twist with a dumbbell or with a medicine ball, like the picture on the right. And then any of the things I just talked about for the spine in combination. So repetitively bending forward as far as you can. So you're doing it over and over, you're going as far as you can, and that can cause a lot of stress on the spine. So for example, if you're working through a sun salutation and you're doing it many times in a row and you're doing the forward flexion or the forward bending as far as you can, and you're doing it several times in a row, then that will need to be modified. Perhaps you can do it, you don't have to do as many repetitions. You can modify the forward bend, and we'll talk about some examples of how you can do that. So I've already mentioned this a couple times, but I'll come back to it because it's really important. A lot of times people only think about the position and they don't think about how they got to it or how they got out of it. So a really good example is downward facing dog. So in this position, downward facing dog, if you're doing it correctly, there's actually very minimal risk because you're in a nice lengthened spine. You're bending at your hips rather than at your spine. So you can see in this picture, she's got a nice bend at where her pants would crease. So if you're, for example, if you're standing on one leg, and you lift up one leg, where your pants crease, that's actually your hips. So if you bend there, that's protecting your spine. So in this picture, she's bending at her hips rather than at her waist. She's got a nice lengthened spine. But the transition in and out of it is really important and something that might need to be modified. So for example, if she, to get out of this position, jumped her feet to her hands and rolled up one vertebrae at a time, then that would be a rapid flexion and then a sustained flexion through the spine. So those are things we'd want to modify. And I have a video of a safer way to do that. So don't forget about how you get in and out of positions as well. So here's an example. I was going to show you a video. This is how to modify that transition. So Adria's in her downward facing dog. So this is what we don't want to do. We don't want to jump our feet to our hands. So a better way to do it is to walk your feet nice and gently towards your hands and come to a not full forward flexion, but you can bend your knees so that you're not fully bent through your spine. And that's a better way to do it. So I'll show it one more time so you can really see. So rather than jumping your feet to your hands and then quickly rolling up, instead you want to walk your feet towards your hands, keeping the knees bent, and then come up through a straight spine rather than rolling up through the spine. Another transition that you really want to modify is how you get from lying to sitting, or vice versa, sitting to lying. So I'll show this video, and so this is what we don't want to do. We don't want to kind of roll up through a flexed spine or a forward bent spine. Instead, you want to roll onto your side, push up with your arms, and then come into sitting position. So you'll see that when Adria does that, she doesn't go through a whole lot of forward bending. So rather than doing a quick forward up motion, roll onto your side and come up that way. So you'll also notice in the video, so you can go up that way, that's not great, but also going down that way is not great either. So how you can modify that is you just reverse the steps of going up. So you would, from a sitting position, you would just go onto one hip and lie down sideways and roll onto your back first. So again, it's not necessarily any position that is the problem. Lying on your back is actually a really good place to be with osteoporosis, but it's how did you get there and how did you get out? So why am I saying all of these movements need to be modified? The main reason is that they put a lot of pressure on your spine and hip bones in certain ways that increase your risk of breaking a bone. So like I was talking about with the sitting position, it compresses your spine more than standing or lying on your back. So if you're already in that kind of compressed and there's a lot of pressure on the spine, and then you're moving into a position that puts more pressure onto the spine, then that can increase your risk for fracture. And since osteoporosis and low bone mass already makes your bones more susceptible to being broken, they're more likely to break, they break easier, you want to try to control how much pressure you put on your spine. So you'll notice that I'm using my words carefully. I'm not saying you can't ever do these movements, because of course we all want to live our lives. We want to participate in activities like yoga that bring us joy and improve our quality of life and improve our balance. It's all about modification. So I'm not saying don't ever do yoga. It's how can we modify it so that it's safer for you. So let's get a bit more specific. So I gave you kind of a general overview of what we want to try to modify, but let's get a bit more specific with specific postures that you can continue to do, that you really shouldn't do, and that should be modified. So yoga postures you can continue to do with proper instruction and guidance and are actually quite good for you are things like corpse pose or shavasana. A bridge can be quite good. The warriors positions are good. Mountain, chair, sphinx, and locust. Those are all good positions and encourage an upright, lengthened position. Ones you want to avoid and you want to minimize for sure are things like spinal rocking. So that's where you are lying down on your back, you bring your knees into your chest, and you rock into like a seated position and then rock back down, rock into a seated position. So there you're in a really compressed position and you're doing it repetitively. So it's not a safe movement to be doing. Ragdoll, like, is featured on the right-hand side. So doing a full forward bend like this can put a lot of pressure on the spine if you have osteoporosis. Saw, plow, and pigeon. And I already mentioned pigeon before. Ones that you can continue to do, but you want to make sure that you've got the proper guidance, instruction, and modifications are the next couple. So the first one is child's pose, which is a really great position. And a lot of times we use it as kind of a rest position in between different postures. But if you're in this position, so if you look at the picture on the right, if you're in this position for a long time, you can see that she's very rounded through her spine. So if you're staying here for, more than 15 seconds or so, then it can put a lot of pressure on your spine. Or if you have, limitations in your hips, so you're not able to be in quite as good a position and stay lengthened through your spine, then it's something you definitely want to modify. So there's different ways you can do this. You can stack your fists and place your hands on, stack your fists on top of each other and place your head on those fists. Or you could use a bolster. So I do have a couple of videos for you here. So this is one way you can modify it. So you can basically take a bolster or a nice big pillow or blankets and roll them up and place them between your knees. And then you can use that to rest your head. And you can even, build it up higher if you needed to. The other thing you can do is you can take your fists and stack them like so. So they are under your forehead. So you can see from the side, when she does these modifications, her spine is in a much more lengthened position than if she were to rest her head right on the ground. So your other option is you can stack your fists like so. So you can still do this position. It's more how you're going to modify it so that you're in a nice, safe position while you're doing it. Other ones that you want to modify are twists. So we talked about this at the beginning, so I promised I'd come back to it. So here we are. So twists can definitely be problematic. So a seated twist like we have pictured here. So the person has kind of locked their legs together, they're seated, so they're already compressed, and now they're twisting as far as they can. So this could be a really stressful on your spine and could increase your risk for fracture. So how you want to modify this is you want to limit how far you're going. So you don't want to try to twist as far as you can. The other thing you can do is do your twists lying down instead of sitting. So when you're in a lying down position, you are less compressed through your spine just because of the way gravity works. So when we're lying down, we're not as compressed as when we're sitting. So it's actually safer to do twists lying on your back than in a seated position. The other thing you can do is in a knees down twist. So if you're lying on your back and you're dropping your knees to one side, you can rest your knees on something so they don't go quite as far. So it's basically limiting how far you can go with that twist. So you can rest your knees on a wall or a folded blanket or a bolster or whatever's nearby so that you're not going all the way as far as you can. And then you don't want to double wrap your legs during supine twists or during seated twists. So double wrapping is if you look on the picture on the right, that's an example of kind of wrapping your legs. So if you were doing your twist lying on your back, you want to just keep your feet together and your knees together and do a simple twist. And that's because double wrapping your legs will increase how far you can go, and we don't want to go as far as you can. So a few more examples for you here. So you can see first, she didn't go down in the best way. And now this is a full twist, dropping the knees to the ground. So that's too much on the spine. So how you can modify this is bringing your knees and your feet to a bolster so that you're supported. And you can even keep your feet on the ground, and that will be less of a twist. The other way you can do it is you could go to the other side. I think it's my next video that's the other way you can do it, but this just shows you both sides. And then remember, when you get up, you're going to transition through a safe position to get up. Okay, so I'll show that one more time, and then we'll show you the other way to do it. So you don't want to drop your knees all the way to the ground because that's going to make you twist as far as you can. So instead, have something nearby, bolster, towels, blankets, wall, chair, partner, that you can rest your knees on so that you're not twisting as far as you can. So the other thing you can do is you can start lying on your back. So transitioning down to a safe position, lying on your side, and then you can open up and twist this way. So same thing, Idra is not twisting as far as she can by bringing her arm down to the ground. Instead, she's resting her arm on something, the bolster, towels, whatever you've got, so that you still experience the twist, but it's not as far as you can go. So one more time, transitioning down in a safe way, starting on your side, and then opening up the arm and resting it on an object so that you're not twisting as far as you possibly can. So you still can do twists, it's just making sure you're doing them safely. So other postures you can do with proper guidance. So this is a really good replacement for pigeon. So pigeon, you're externally rotating your leg. That was the posture I showed you at the beginning, where you're externally rotating your leg, turning it out to the side, and then resting your entire body weight on it. And that can put a lot of pressure on the hip. So thread the needle is a really great alternative and doesn't put as much stress on the hip joint and decreases the risk of having a fracture in your hip while you're doing it. Just remember to keep your head down. So like this picture, you can see this woman has her head down on the ground. So rather than rounding your back up, rounding your neck up, trying to look at your legs, you want to keep your head down on the ground. And that's just, again, to avoid that compression through the spine. So keeping the head down, and then you can reach through and grab your leg and pull it gently towards you. If you can't reach your leg, that's okay. You can use a yoga strap or a towel or whatever you need and interlace it through your leg and then gently pull towards you. Again, gently pulling, so we're not going into full external rotation of our hip or putting it in a really outward twisted position. So next thing is answering some frequently asked questions that I usually get when I give these types of presentations or I talk about yoga. The first one is, should I use props like blocks, blankets, or yoga straps to help me? So as you can see throughout this presentation, I gave lots of examples of where you can use props like yoga blocks. You could use a bolster, you could use blankets, yoga straps. I think I mentioned all of them throughout the presentation at some point to help you. The main thing that I want you to think about when you're using these props is how are they helping me and are they keeping me safe and in good alignment? So sometimes people use props to help them go further into a position than they really need to. But if you're using these props to help you stay in good alignment, to help keep your balance, then they're great to use. So you just want to think about, why am I using this prop, and is it helping me stay safe, or is it helping me go perhaps too far into a position or into a position that's not going to be good for me? Maybe it's going to make me twist more or bend forward more, or maybe it'll make me move faster, whatever it might be. Another example is a chair, using a chair to hold on for balance. If you're doing standing positions where maybe you feel a little bit wobbly, and that's perfectly fine. Just like at the beginning, I mentioned that you want to make sure it's a sturdy chair. So it's not going to move when you move. If you lose your balance, it's not going to come down with you. Make sure it's really sturdy and it's not going to go anywhere. If you don't have a sturdy chair nearby, the wall is usually sturdier, or a counter, like a kitchen counter or something along those lines. Just something that's not going to fall down when you need to grab onto it really quickly. So certainly use props, but use them to help you be in good alignment and be safe rather than pushing you really far. Another really frequently asked question I get is, what about chair yoga? So a lot of times people will practice yoga and maybe it's in a community center or maybe it's at home now because of the pandemic, but they do it in a chair. And so there's a couple things to think about in a chair. Certainly if you have difficulty standing or you have really wobbly balance, then a chair could be a really good place to start. But you have to be very careful of how you're doing your different postures for yoga. And I have some examples in a moment with the video. But remember, I mentioned that when you're sitting, you actually have quite a bit of compression on your spine already, more than if you're standing or lying down on your back. So any position you do sitting, you have to be very conscientious and very aware of what your spine is doing. So if you are sitting, you're doing chair yoga, you really need to think about lengthening through your spine and trying not to bend forward as far as you can. So for example, sitting on the chair and just rounding forward so your hands are touching the ground or reaching towards the ground. Or maybe sitting in the chair and doing a twist as far as you can. Those are things that definitely need to be modified. I would suggest, if you can stand or if you can get down to the ground, those are safer positions to be in. You just have to think about yourself. So is the ground an option? Sometimes it's not, and that's okay. Or could you stand and hold on to something sturdy? The great thing about standing is you'll actually get the benefit of being weight bearing, which is good for our bones. So you're putting weight through your legs and through the bones of your legs, but it will also help improve your balance. And that's really important for trying to prevent falls and trying to prevent fractures. So I recommend, if you can stand, definitely stand. If you can lie down, that's great too. If you're doing it in a chair and that's what you're doing, that's okay too. You just have to be very careful of how you are bending forward and how you are rotating. So here's an example of how you could modify something in seated. So this is a modified seated forward stretch. So this video I've got here for you. So rather than putting your leg out and reaching your fingers towards your toes and trying to touch your toes and really rounding through your back, this is a much better way to do it. So putting your foot out, keeping your leg somewhat straight, and then bending forward at your hips. So you can notice her spine staying nice and long and straight. The other thing you want to think about, I'll show it again here, is what your pelvis is doing. So you want to try to almost kind of stick your bottom out behind you, rotate your pelvis forward a little bit, and then you'll get a nice stretch. So usually what we're trying to do is get a nice stretch in the back of our leg with this. So you will get that very easily. You won't need to bend forward and touch your toes to do it. So one more time here for you. You want to put your leg out and then try to keep a nice long spine. Stick your bottom out behind you and then bend forward at your hips. So again, remember your hips are where your pants crease when you lift your leg up, not your waist, which is, around kind of your belly height. You want to bend forward at your hips. The other thing you can do if you're not really feeling a good stretch in the back of your leg when you do this and you want to feel more of a stretch is you can bend your ankle a bit more and bring your toes up towards your nose. That will give you a nice stretch in the back of your leg. So another example for you is a seated twist. So rather than doing a twist where you're just rotating as far as you possibly can, pulling with your arms, really stretching as far as you can. Instead, what you want to do is have a nice feeling of lengthening through your spine, and then just go maybe about halfway. So you're not twisting as far as you can, you're not really pulling with your arms to wrench around. Instead, you're just going about halfway. And the really important thing is, you can see her do it right at the beginning, is do a nice lift like that. So even though this is the bad version, the lift at the beginning is really important because that makes sure you're in a good position to do a lift before you start rotating through the spine. And remember, you're not going as far. So as I mentioned, chair yoga can be okay. You do have other options and you just have to think about the risks and benefits of all of them. But if you are doing anything seated, make sure you are thinking about how to modify it. And the last question I often get, although less so now during the pandemic, is what about hot yoga? Because a lot of us are doing yoga in our houses rather than going to a studio to do it. So my biggest thing about hot yoga is that it can cause people to overstretch, and that can put you in unsafe positions. So I usually recommend not to practice hot yoga if you have osteoporosis, because it can put you at risk for fractures because you'll feel warmer. Usually the class is maybe a bit more faster paced, and you tend to go into further positions and go further than if you're just practicing yoga without it being hot. So I usually do not recommend it. So the main kind of points for you of all the things I've said, take-home points are: remember to practice at your own pace. It's not a competition. You got to do what's best for you. Seek out a yoga instructor who is trained. And if you want advice, seek out somebody who is bone fit trained so they can give you very specific, individualized advice for you. Remember, you need to advocate for yourself. Nobody will know you have osteoporosis unless you tell them. It's nothing to be ashamed of. They just need to know why you might be modifying something, or hopefully they will also give you modifications to do. You want to modify any activities that include forward bending or rotation of the spine or forced rotation of the hip, and anything that is repetitive. So you're doing it over and over. It's rapid, it's really fast, weighted. So maybe you're holding something heavy, like I said, if you're doing a class that also involves some strengthening, or is a combination of any of these. And the last point is you only want to use props that help you stay aligned and keep your balance and stay safe, not ones that push you further than you should. So thank you very much for listening to me today. I'm going to have any questions now. So I think Tanya is going to let me know what the questions are.
Thank you very much, Dr. McArthur. That was a wonderful presentation. Very comprehensive and very wonderful with the demonstrations as well, to show us what some of those poses and how some of the poses need to be modified. So yes, we have some questions. One is, I take Tai Chi. Many movements require twisting your hips and spine. How safe is this?
Yeah, it's a great question. So there's a lot of activities that are similar to yoga, like Tai Chi, and certainly a lot of the positions inside the Tai Chi could also put you into those end range motions that we want to try to avoid. So the same principles apply as what I talked about today. So you want to try to modify anything that bends you forward. You do rotations, or you do any combination of those. So you want to try to minimize those same movements. The nice thing about Tai Chi, from what I understand, I'm not an expert in Tai Chi, but from what I do understand about it is it tends to be a bit slower, and you might not have those rapid changes that I had talked about before. So it's though it is slow, you still need to modify those same movements. So anything that rapidly rotates or takes you to end range rotation, takes you as far as you can into forward bending, then those do need to be modified. So I would suggest things like bending at your hips, like we talked about today, thinking about being aligned and nice and lengthened. So reaching up through the crown of your head or the top of your head before you do those movements. Those are some tips that can help you stay safe during Tai Chi. That's hard to say.
Thank you. You may have answered this one already in the presentation. Over the years, I have read that pigeon pose is not recommended as it puts excess stress on the femoral neck. Please comment.
Yeah, so I did answer that. So I gave you a suggestion for how to modify it. So you don't want to be in that position where you're kind of forcing your hip into external rotation with your full body weight on it. So instead you can do the modification where you're lying on your back, and then you're not putting all of your body weight on it, and you're not going to that full external rotation.
Okay. What exercises should be avoided if you have had a wrist fracture?
Right, so I didn't really talk about wrist fractures. I mainly talked about your hip and your spine, but we know that wrist fractures are really common with osteoporosis. So if you've recently had a fracture, there's a lot of positions in yoga where you're going to be putting weight on your hands, like for example, downward facing dog or a tabletop pose, or there's lots of different examples. So clearly those positions will need to be modified and avoided for at least initially until the wrist has healed. But once you have clearance to put weight through your hand, so once your cast has been removed, you've worked through your rehabilitation, your physiotherapist and your doctor tell you it's okay to put weight through your hands, then it's important to get back to those activities. Because sometimes what can happen with wrist fractures is we get a lot of limitation in our movements. We're not able to fully extend or flex our wrists, so we can't move it all the way through the range of motion. And doing some of those weight bearing exercises can actually help with that. So just make sure you've gone through the proper channels, you've done your rehab exercises, and you're ready to put weight through your hands. Then those are good ones to start adding back in once you kind of have the green light to do so. It's going to be individual, and it's going to depend on, if you had any complications with your wrist fracture, exactly how it was broken, how long you were in a cast for, all sorts of different things. But once you have the green light, then definitely start to add those back in. And weight bearing through the wrists can help get some of that range of motion back.
Okay. Any implications for someone in their 20s with osteoporosis who has good balance, but also osteoporosis?
Yeah, great question. So a lot of times when we think about osteoporosis, we think about older people, but we know that people get osteoporosis for many reasons, not just related to aging. People have it related to if they have had cancer treatment, or if they've had any sort of disorder with eating, or with absorption of nutrients like Crohn's disease or colitis. and you can't absorb nutrients the same way from your food. So certainly many different age groups can have osteoporosis. So I'm glad that this question came up. So the same principles will apply regardless of your age. I always say it's really important what your experience is with yoga. So if you're brand new to yoga and you're just starting out, then there's going to be, different considerations that if you practice yoga for a really long time and you're really comfortable with doing different postures and you're very aware of your body. So it can be quite individualized, but the same types of modifications are going to be important. So you still want to modify your seated twists. You still want to modify going into full forward flexion repetitively. Those same kind of general principles apply, but you may be able to do, depending on your experience and your background, you may be able to do some more advanced movements. And likewise, if you are older and you've practiced yoga for 30 years and you're quite comfortable in different positions and have good balance, then certainly there's positions and postures that are going to be more appropriate for you than somebody who's starting out. So it comes down to your experience level as well. It's not necessarily just your age, but those same kind of general principles are always going to apply around movements that you want to modify for your spine.
Thank you. Are the safe osteoporosis practices for yoga also applicable to Pilates, or are there any special consideration for Pilates? I think that's also a popular exercise like Tai Chi. So.
Yeah, exactly. And my answer is the same. The same principles apply to Pilates as they do to yoga. So you just want to think about the movements that you're doing, and you want to modify and limit those ones that take you into full range spinal flexion, so bending forward as far as you can, or rotating as much as you can. And then, so yeah, really the same modifications apply, and doing things repetitively, rapid, weighted, and range, any combination of those needs to be modified. So same principles apply as they do for yoga, as they do for Tai Chi, as they do for Pilates. You just have to kind of think through everything you're doing and think, is this putting me into one of these positions that I should modify?
Okay, it seems like this is a movement that can happen quite frequently in yoga. How do I go from sitting to lying down? And I imagine the same thing would apply to going from a standing position to lying down.
Yeah, so great question. Again, it will depend on your individual strengths and limitations, but the one video that I showed is really the best way to do it. So from sitting, if you are, let's say you're sitting cross-legged, you want to swing your legs to one side and lie down on your side, and then roll like a log or like a hot dog onto your back so that you're lying in a good position, a lying position there. And then to get up, you just reverse it. So you roll onto your side, push up with your one arm, and then so you're kind of sitting on your hip, and then just swing your legs around. If you have good arm strength, good upper body strength, you could roll from your side all the way onto your belly and push up, do a push up to get up, or lower yourself down. But usually I tell people to just lie down on their side and then roll onto their back. If you want to go from standing all the way to sitting, there's a couple different ways you can do it. And again, it depends on your balance and the strength you have in your legs. But one way you can do it is to come down onto one knee, and maybe you're holding on to something like a counter, a bed, a couch, if your balance is a little wobbly. And then bring your other knee down, so you're on both knees. Bend forward at your hips so that you come into tabletop, so your spine stays nice and straight, but you're on your hands and knees, basically on all fours. And from there, you can just do what I said for going down all the way to the ground. So you can either sit on your side and roll onto your back from there, or you could, from hands and knees, you can lower your body down, kind of like a reverse push-up, and then roll onto your back from there. And to get up, you just reverse those steps. So from your back, you can either roll onto your stomach and push up onto all fours, or you could roll onto your side and push up sideways, come so that you're on all fours, and then swing one leg through. And then either, depending on your strength and balance, you could use a chair or a couch or whatever to help push yourself up, or you could just stand up, push up from your legs if you have good strength and balance, so that you're standing on both feet. So you just want to think about keeping your spine as lengthened and as upright as possible while you're doing this transition, so you're not going through a big bend or rotation. So what you don't want to do is sit down on your bottom and then roll down through your spine onto your back, and then to get up, do like a sit-up position where you kind of like heave ho, flex forward. So that's what you don't want to do. You want to try to modify that to the best you can. I prefer the rolling onto the side and coming up that way, but some people like to roll all the way onto their belly to do that.
Okay, I think we have time for one more quick question, and then the time for our webinar will be coming to an end. So this is, in my gentle yoga class, we do legs to the side, where we lie on the ground, one leg extended straight out on the ground and the other leg extended straight up, and then opening to the side as much as possible to the ground, and then we also put that leg across over the body. So are these safe for the hip?
So they're safe for the hip. I would be a little concerned of the amount of pressure that's going through your lower back when you're doing that, for if you do have osteoporosis. So I wouldn't kind of let your leg just kind of hang in the air. So if your one leg's up to the ceiling and you're swinging it from one side to the other, it would be better to rest your leg on something, or perhaps do it with your knee bent, because when your leg is fully straight and you're holding it up, that's a lot of work for your lower back to do, and it puts a lot of pressure through your spine. So perhaps if you do it beside a wall and you can rest your leg on the wall, or like I said, if you bend your knee and do it with your knee bent, that would be less work for your body to do, and therefore a little bit safer for your spine. So it's not so much that the hip would be a problem, it's more that it's a lot of work for your lower back to do. And so it's better to have that leg supported either on a chair or a wall or a bolster or a bunch of bolsters or a bunch of yoga blocks, so that it's not, you don't have to, your spine doesn't have to hold it upright.
Okay, thank you very much. Okay, oh, there we go. All right. For tools and resources to help you manage your bone health, visit osteoporosis.ca. You can sign up for COPN, the Canadian Osteoporosis Patient Network. Have you listened to Unbreakable, the OC podcast? You can find episodes on the website you can find episodes on the website, or you can stream Unbreakable through your favorite podcast provider. Check out the Know Your Risk quiz, and you can also view the recorded version of this and other webinars on the OC Replay webpage. This one will be available in the next 24 to 48 hours. Again, thank you to both Dr. Caitlin McArthur and to everyone watching. Be sure to stay connected by subscribing to the national e-newsletter at the bottom of the OC website homepage to get news, information, and notices of upcoming webinars directly to your inbox. You can also follow us on Facebook, Instagram, and Twitter. Until next time, thank you for joining us today, and please continue to stay well and stay connected. Take care, everyone.